The year 1918 dawned with the world at war. A different kind of battle was brewing, one that would leave a deeper scar on humanity. The Spanish flu swept across the globe, infecting 500 million people, one-third of the world's population. This deadly outbreak killed 50 to 100 million people, more than World War I casualties. The 1918 flu pandemic stands as a stark reminder of the power of infectious diseases. It serves as a testament to the vulnerability of societies when faced with a novel pathogen. The story of the 1918 flu is one of scientific mystery, human tragedy, and resilience. The precise origins of the 1918 influenza virus remain shrouded in mystery. Scientists continue to investigate its origins, tracing its genetic footprints across time and geography. One theory suggests the virus emerged in Haskell County, Kansas, in early 1918. It spread rapidly through military camps and across the Atlantic with World War I troops. The virus thrived in the crowded and unsanitary conditions of wartime. The H1N1 subtype was deadly due to rapid mutation and severe respiratory illness. Its airborne spread made it highly contagious. The world of 1918 was already grappling with the unprecedented challenges of a global conflict. World War I had ravaged Europe and beyond, leaving countries struggling to cope with the human, economic, and social costs of war. The conflict had strained healthcare systems, disrupted economies, and diverted resources away from essential public health services. Into this already vulnerable landscape, the 1918 influenza virus emerged, exploiting the weakened state of nations and their populations. The war effort had led to the mass movement of people, with soldiers being deployed across continents and civilians fleeing their homes. These mass migrations facilitated the rapid spread of the virus, carrying it to all corners of the globe. Moreover, wartime censorship and propaganda often downplayed the severity of the outbreak, hindering public health efforts to contain the virus. Governments were reluctant to acknowledge the full extent of the pandemic, fearing it would undermine morale and war efforts. This lack of transparency allowed the virus to spread unchecked, exacerbating its impact. Unlike the visible enemy on the battlefields of World War I, the 1918 influenza virus was an invisible and insidious foe. It struck swiftly and indiscriminately, leaving a trail of illness and death in its wake. The virus attacked the respiratory system, causing a range of symptoms from mild fever and cough to severe pneumonia and respiratory failure. One of the most striking features of the 1918 flu was its tendency to kill young, healthy adults. Typically, influenza is most dangerous to the very young, the elderly, and those with weakened immune systems. However, the 1918 virus disproportionately affected young adults between the ages of 20 and 40, a demographic typically considered to be the healthiest segment of the population. Scientists believe that the virus's unusual virulence in young adults may have been due to a phenomenon known as a cytokine storm. This occurs when the body's immune system overreacts to the virus, triggering a massive release of inflammatory molecules called cytokines. This overwhelming inflammatory response can damage the lungs and other organs, leading to respiratory failure and death. In the absence of effective antiviral drugs or vaccines, healthcare workers in 1918 were largely powerless to stop the spread of the influenza virus. They relied on basic public health measures, such as isolation, quarantine, and good hygiene practices to try to contain the outbreak. Hospitals were quickly overwhelmed with patients and medical supplies ran short. Doctors and nurses worked tirelessly, often around the clock, to care for the sick and dying. Many healthcare workers themselves succumbed to the virus, further straining the already overwhelmed healthcare system. The lack of effective treatments for the 1918 flu led to a desperate search for remedies. People turned to traditional medicines, home remedies, and even quack cures in a desperate attempt to protect themselves and their loved ones. However, most of these remedies proved ineffective, and some even harmful. The 1918 flu pandemic brought cities around the world to a standstill. As the virus ripped through communities, businesses closed, schools shut down, and public gatherings were banned. The streets, once bustling with life, became eerily quiet as people stayed home, afraid to venture out and risk infection. The pandemic had a profound impact on daily life, disrupting transportation, commerce, and social interactions. People were urged to avoid crowds, wear masks in public, and practice good hygiene, such as frequent hand washing. However, these measures were often difficult to implement consistently, and the virus continued to spread. The fear and uncertainty surrounding the pandemic led to social isolation and widespread anxiety. People were afraid to leave their homes, afraid to interact with others, and afraid of losing loved ones. The pandemic tested the fabric of communities, revealing both the best and worst of human nature. The 1918 flu pandemic was not only a physical health crisis, but also a psychological one. The rapid spread of the virus, the high mortality rate, and the lack of effective treatments created a climate of fear and uncertainty. People lived in constant fear of contracting the virus or seeing their loved ones succumb to its deadly effects. The pandemic had a profound impact on mental health, leading to increased rates of anxiety, depression, and post-traumatic stress disorder. The constant threat of illness and death took a toll on the collective psyche of communities, leaving a legacy of trauma and loss. The pandemic also exposed and exacerbated existing social inequalities. The poor, marginalized, and minority communities were disproportionately affected by the virus, often lacking access to adequate healthcare, sanitation, and other resources. The pandemic highlighted the need for equitable access to healthcare and social services, a lesson that remains relevant today. The 1918 flu pandemic left an enduring legacy on the world, shaping not only the field of public health but also art, literature, and popular culture. The pandemic's impact could be seen in the increased focus on public health infrastructure and the development of new vaccines and treatments for infectious diseases. The pandemic also left its mark on the arts, inspiring novels, poems, paintings, and films that explored themes of loss, resilience, and the fragility of human life. The pandemic's cultural legacy serves as a reminder of the power of art to help us process trauma, find meaning in suffering, and connect with others who have shared similar experiences. The 1918 flu pandemic also had a profound impact on scientific research, leading to major advances in our understanding of viruses, immunology, and the epidemiology of infectious diseases. The pandemic spurred the development of new techniques for studying viruses, tracking their spread, and developing vaccines and treatments. The 1918 flu pandemic offered valuable lessons about the importance of public health preparedness, the need for international cooperation, and the enduring power of human resilience in the face of adversity. The pandemic highlighted the critical role of public health infrastructure, including hospitals, laboratories, and trained healthcare professionals. It also underscored the importance of international cooperation in tracking and responding to outbreaks of infectious diseases. The rapid spread of the 1918 flu across borders demonstrated the interconnectedness of global health security and the need for coordinated efforts to prevent, detect, and respond to health threats. Moreover, the pandemic revealed the resilience of the human spirit as individuals, communities, and nations came together to support each other, care for the sick, and rebuild their lives. The stories of courage, compassion, and innovation that emerged from the pandemic serve as a testament to the enduring strength of the human spirit. The echoes of the 1918 flu pandemic can still be felt today. The COVID-19 pandemic, which began in late 2019, has drawn many parallels to the 1918 outbreak, reminding us of the devastating impact of pandemics and the importance of public health preparedness. The COVID-19 pandemic has highlighted many of the same challenges faced during the 1918 flu, including the need for effective vaccines and treatments, the importance of clear and accurate public health messaging, and the social and economic disruptions caused by pandemics. However, the COVID-19 pandemic has also showcased the remarkable progress made in public health since 1918. Advances in virology, epidemiology, and vaccine development have allowed us to develop effective vaccines and treatments for COVID-19 at an unprecedented pace. The lessons learned from the 1918 flu and other pandemics have been instrumental in shaping our response to COVID-19 and mitigating its impact. The 1918 flu pandemic stands as a stark reminder of the ever-present threat of infectious diseases. It serves as a call to action for continued investment in public health infrastructure, scientific research, and global health cooperation. The legacy of the 1918 flu is a legacy of vigilance, preparedness, and a shared commitment to protecting global health security. By learning from the past, investing in the present and working together, we can strive to create a future where pandemics are not a matter of if, but when and where we are better prepared to respond effectively and protect the health and well-being of generations to come.